So understanding patient communication. So in listening test and all, it is very important that you understand what the patient is saying during the consultation extracts. In OET listening part A, we have consultations. Right. So let's take a look into this particular question over here. So here the question is, lately I have been feeling like my heart is racing, even when I'm just sitting still. It's been happening on and off for a week. So here the question is, what is the most appropriate medical term for what the patient is describing? So here you need to understand what is the meaning of heart is racing. Okay, so that is a figurative speech. So what will be the right answer over here? Just type your answer in the chat box. All right, so we have Patan choosing answer option B. Okay, the heart is racing. So here you need to have some knowledge regarding medical terminology. Okay, so very good. All right, so the answer option is basically B, palpitations. Okay, that is rapid heartbeat, tachycardia, we can say. Okay, bradycardia is basically very slow heartbeat. The frequency of heartbeat is very slow. Dyspnea is basically respiratory distress. Okay, this is pronounced as dyspnea. Okay, the P is silent. And then D, angina. Angina basically means chest tightness. Okay, so very good. All right, so we have two students who have joined in. Geo, I'm not sure who that is. And we have Murli here. Hi, Murli, good evening.
Hi, sir.
Okay, good. Thank you for logging in. Right, so now let's go to the second question over here, and then we will discuss with the reading part B. Okay, so reading part B also, we have to be very participative. So I just encouraging participating over here. So read the second question. Understanding the tone and attitude. Okay, so just by reading a sentence, you must be able to identify, you must train yourself to identify what is the attitude of the speaker or the writer. So here, this sentence is, while the surgery carries some risk, the benefits far outweigh the potential complications. What is the writer's attitude? So for this, you need to know what is the meaning of far outweigh. What is the attitude of the writer? So this writer is saying surgery has some risk. The benefits outweigh the potential complications. So it is a wrestling competition between benefits and complications. But you need to understand what is the meaning of outweigh. Is it A, B, C, or D? What is the attitude of the writer? I'll give you 15 more seconds. Right, so 5 seconds more. Right. So the correct answer option is basically C option. Okay. The right answer is optimistic and reassuring. So optimistic basically means what? Positive. Okay. The writer is positive. Okay. Reassuring also means a positive. So what is the sentence saying? The sentence is saying, the writer is saying, the surgery has some risk. Okay. The writer is not denying the possibility of risk. He's saying there is risk in this particular surgery, but at the same time, there are benefits. Okay, now what is he saying? The benefits far outweigh. That means the weight of the benefits, the quantity of the benefits are much more than complications. Potential complications. Potential means possible. It may or may not be. Okay, so there may be complications, but however, the benefits are much more in number. The quantity is much more. So that is the meaning of outweigh. Okay, quantity is much more. So here he is saying the benefits are more. So benefits are more means what? It is an optimistic. He is positive and reassuring. Okay. Critical and disapproving will not be the answer. Critical basically means then complications are more. Okay, so that is the meaning of outweigh. All right, so very good job. Now let's go to the third question. So here, when you're doing your OET listening test, okay, it is very important that you have prediction skills. Okay, that is just by listening to a statement, you must be able to get the clues from it. So here the patient is saying, I have been feeling this tightness in my chest whenever I walk up the stairs. What is the most likely concern the doctor would explore next? So when the patient is saying this, what will the doctor do? Yeah, okay. So it's a very straightforward question. So this requires your medical judgment, all of your medical professionals over here. So the answer option is basically C option. Right. C will be the answer. Tightness in my chest. Okay. Basically means this thing. Cardiac function. So stomach ulcers is abdomen, right? Muscular injury is full body, general, and skin rash is the superficial outer layer of this human body. So tightness is okay. So again, it's a simple question. Okay, so like this, especially in listening. So those who haven't done any OET listening, understand that in OET listenings, you will be hearing certain audios. Okay, you will be hearing patient consultations. The patient will be having a conversation with the doctor, and just by listening to the conversation, you must be able to predict, okay, what the our next outcome is going to be. So if a patient is going to say this, obviously the doctor is going to be concerned about the cardiac function of the patient. Okay, so that inference knowledge will be very important. Now let's go to the fourth one, and this is going to be testing on your grammatical accuracy. So are you ready? Choose the correct option to complete this sentence. So here your grammatical range is important. The nurse dash the patient to take the medication with food. Right. So everyone has gone with answer option A. The right answer is answer option A. Right. So now a trick question. So those who are relatively new over here, there are two spellings you see. Now you see over here for this advice spelling, the letter C they have used. Okay. But over here, they have used the word S. Both are accepted, but both are completely different. Okay. So what is the difference between advice with a C and advice with an S? What is the difference? So especially in OET writing, okay, when you will be writing your OET letters, and even in listening also, fill in the blank question, sometimes you may have to write advice and all, but you have to write the correct spelling. Okay. So those who do not know, always remember this. When we write advice with a C, then that means that is a noun. When we write advice with a S, that is a verb. Okay, now you see over here, the nurse advised the patient. So what is the nurse doing? The nurse is advising. Okay, the nurse is doing an action. Okay, so action is a movement. Okay, so in that situation, we use the word as advise. But if you want to write like this, okay, uh, like for example, if an important advice was given to the patient. Okay. Now you see in this sentence, what is happening? It is not a verb. Okay. Here, the advice is a noun. Okay. Here, advice is not an action. Okay. So here, the nurse is doing an action. That is why S we use. But here, the word is a noun. Noun basically means a thing. So a thing was given to the patient. What is the thing? The advice was given. So in that case, we use the word see. Okay, so this knowledge is very important. Many students make this mistake in listening fill in the blank questions as well as OET writing letters. Okay, so that is important. Now let's go to the very fifth question over here. Okay, so here the question over here is understanding figurative language. Okay, that is opposite of literal language. Anyway, here the statement is this: the treatment was a double-edged sword. It relieved the pain, but caused severe drowsiness. What does double-edged sword imply here? So this is slightly difficult. Here you need to have very good vocabulary skills. Double-edged sword. So this is very common. This is I have seen this word in OET question papers. Right. So what's the answer that you have chosen? Right. So the correct answer option is B option. Okay, B is the right answer. Okay, so yeah, I think everyone has gone with answer option B. Okay, very good, very impressive. It is actually a very tough question, and you have chosen it. Okay, so here what is statement saying? The statement is saying the treatment was a double-edged sword. So see, when you think about a sword, sword means very warrior knife. Okay, knife that warriors use. Right. So it every knife has two edges. Okay, so that is the thing. So over here, the person who is using the sword, it causes damage, but at the same time, it causes some benefit as well. Okay, so for example, when you are killing an enemy, yeah, the enemy dies. Okay, but at the same time, you killed a person. So a positive as well as a negative. So when we want to say one action, but in the same action, okay, there was a benefit, but at the same time a disadvantage as well, we use the term double-edged sword. Okay, that means the sword has two edges and both of them have two separate outcomes. So here the treatment relieved pain. Okay, the patient got pain relief, but it caused severe drowsiness. Okay, so that is the positive as well as the negative. And what is the sword over here? The sword over here is the treatment. The treatment is the sword. Okay, and the treatment caused pain, which is negative. It relieved the pain, that is positive, and it caused drowsiness, which is negative. Right. So the right answer option will be B. The treatment had both positive as well as negative effects. Okay, so good. That was not an easy question. Everyone did a very fantastic job. Right. So now what we're going to do is let's just have a discussion of yesterday's class continuation. Okay, so we will take the tetanus question paper over here and let's see what we can expect in a reading part B question paper. Okay, so anyway, um, we have the recorded lectures available 24/7 in the app. Okay, so all you have to do is just log into the app and just scroll down. Tetanus reading part B, very detailed lectures are available. You can always use them for your training purpose. And for doubt clearance, you can log into my live sessions and also you can reach out to me through WhatsApp. Right. So in reading, you have exactly 60 minutes. And how many questions do you have? You have 42 questions. Okay, so reading part B, how many questions do you get? You get 6 questions. And the good news is, there are two good news. Everything is multiple choice questions. First good news. The second good news is there is no negative marking. So if you choose an incorrect answer option, no worries. They are not going to reduce your scores. Right. Now you need to understand that in reading part B, all the questions will be workplace related questions. Okay, that is related to the work. Okay, so that is when you are working in a clinic, or when you're working in a hospital, when you're working in a pharmacy. Okay, when you're working in any medical institution, obviously you will be coming across certain documents. Okay, workplace related documents. So from those documents, the OET people, they take small paragraphs, and they are testing whether you are able to understand workplace related documents. Okay, now see over here in yesterday's class, we said, so this is a guideline. Okay, nursing staff can remove. So this is a guideline to the nursing staff. That is a workplace related document. Okay, now you see over here a protocol. Protocol means a series of steps. Okay, so that is also a workplace related document. So it's a very long document. From that, they take a short export. And then over here, so this question we will be doing today. Now it is a memo. Memo means a reminder. Okay, so that is a workplace related document. So, and then the fourth question also like that. What point? Now you see training manual. Okay, so like this, you will be coming across workplace related documents. Now, the problem with doing fake OET materials. Now, if you most other institutions, and even if you just go to YouTube, Telegram, WhatsApp, there are so many fake OET, reading materials and all. There you will not come across workplace related questions. There they will simply, because it is fake OET materials, you will simply get some random paragraphs and some random questions. Many students innocently believe that they are real OET question papers, and they practice them. And what happens on the examination day? They are completely shocked because the question is not at all according to the format, and they struggle to pass the OET. Okay, so that is why it is very important that you stick to the Cambridge University materials. So whatever materials that we have given you, the materials in the app, the official materials, that you have to do very thoroughly. And then passing the OET becomes a very, very easy thing. Right. So anyway, now that you know that we are going to come across workplace related documents, let's see if you are able to understand the third question over here. Okay, so first you do the third question on your own, and then after that we will be doing the explanation. Okay, so I'll be giving you the right strategies, the right tools, the right techniques, the right methods, how to avoid the traps and confusions in OET. Okay, so take your time and read the third question, the paragraph here as well, and you type your answer in the chat box. Okay. All right, so now let's talk about the right strategies. All right, so first and foremost, you have to understand how cunning the OET people are. Okay, so I hope now it's time to talk about the question over here. Okay, so always never underestimate the OET people. Okay, this everything. So, those who have written the OET previously, everyone says, especially those who have failed in listening and reading and all, they will say that whenever they are doing the OET listening and the reading, 99% of the time they experience nervousness, they experience exhaustion, they experience distraction. Okay, they lose concentration, they lose focus, even though they have practiced at home very nicely. Okay, so it is because the exam environment is designed like that, and the question paper has also been designed like that. Okay, so the OET reading part B has 6 questions, and all 6 questions are completely different from each other. The first question was different, the second question is different, the third question is different. So repeatedly, when you're exposed to different questions in one single stretch, it really drains your mental energy. Okay, so see, when you're doing the OET reading part B first question, your mind is little bit more active. Okay, but by the time when you come to the last question, when you come to the sixth question of OET reading part B, even though you're the same person, you will not be able to give your best performance like you did on the first part B question. Because now what has happened? You have depleted your mental stamina. The OET has taken away your mental energy. And sometimes there may be very difficult questions. Maybe the second or third question was very difficult, and self-doubt comes in. Okay, anxiety comes in, distractions comes in, and all these negative emotions will make you really struggle in the coming questions. Okay, so you must have this predicament that this can happen, and you must mentally prepare for all these problems that is very likely to happen. So it is very important that whenever you're doing OET reading, that you stay quite calm and composed. Okay, because if you're quite calm, if you're composed, what happens is that you will be able to think logically. Okay, logic will be there. You will be able to think practically. Okay, practicality will be there, and there will be rationality. Means you will be able to take very good decisions, and more importantly, your quality of thoughts. Your quality of thoughts is very, very high. So when it comes to OET reading, you need to have high quality thoughts. You need to have thought clarity for you to decode the right answer, and you have to constantly interact with the question paper. Okay, so the strategies I'm going to teach you involves a lot of interaction with the question paper, right? So on your examination day, you will get a printed question paper. So with a pencil, you must underline the important words, you must highlight the important words, you should make some notes, you can scribble, you can write whatever you want in the question paper. Now you see over here, this area is the only area where you should keep the question paper very neat. Now you see, this is where you will be shading the correct answer. So if you believe that C is the right answer, then you have to shade answer option C. Okay, so this area you have to keep very neat. All the other parts of the question paper, you can write, you can scribble, you can make some notes. Okay, that constant interaction will make sure that you do not become tired, that you do not become nervous, and at the same time, those negative thoughts will not impact you in a negative manner. Okay, so that is something you need to do. So I highly recommend that you go to Google Drive. Okay, you take the printouts of the reading and listening question papers and do like that. Now, time conservation and energy conservation is very important, because after you finish reading part B, now you may have to go and do reading part C. Okay, and reading part C, now see how many answer options are here. You have 3 answer options, right? But if you go to reading part C, here you can see there are 4 answer options. That is, one question has 4 answer options. And over here in reading part C, the language is even more tough. Okay, the sentences are even more complicated. You have 4 answer options, and you have 16 questions over here. Okay, so if you waste all your time and if you waste all your energy in reading part B, then you will really struggle in reading part C. Okay, so when you're doing reading part B, you have to make sure that the strategies you're implementing over here is saving you time and saving your energy as well. Okay, so the best way to do that is to always give priority to the question. Okay, now you see, if you read the paragraph first and then if you read the question, yes, you can find the answer. Okay, but what is your duty? Your duty is to find the answer in the limited time possible. Right. So instead of reading the paragraph, come to the question. Okay. And then once you come to the question, these are the steps that you need to implement. So step number one is called comprehension of the question. And to comprehend the question, you have to do the keyword analysis. Okay. I'll tell you what that is. And then once you have comprehension means understanding. So once you have thoroughly understood the question, you must register the memory of the question to your mind. That is what we call as retention. Okay. So with a good memory of the question, with an aim, okay, so you have an aim in your mind. With that aim, with that focus, you have to read the paragraph, right? And then comes detection. Okay, that is now you're trying to detect the correct answer over here. Right. And you also need to understand that here, since everything is multiple choice questions, the best strategy that you can bring over here is the elimination strategy. Okay. That is, instead of focusing on finding the correct answer, focus on eliminating the incorrect answer options. Okay. And for doing the elimination strategy, you having the verb analysis. That is, if you identify the verbs and if you link the verbs to the questions, then the elimination strategy becomes a little bit more easier. Okay, and then there are several other tricks as well that slowly we will be discussing. Okay, so now let's do comprehension of the question. Okay, so let's read the question over here. Let's understand what our duty here is. So here the question is, the report mentioned in the memo suggests that. Okay, so here this is a memo. Memo is basically a reminder. Okay, it's a workplace document. Okay, so it's like a memo, it's like a reminder that the hospital sends to the medical staff. Now, inside this memo, see, inside this memo, there is a report. Report means some fact. Okay, news report. News. So, when you open a news channel, what are they doing? They're reporting the facts. Okay, so here a fact has been mentioned inside the memo. Okay, now what is the question asking you? The question is asking you, what is this report suggesting? Okay, so your duty is to find what is the suggestion of this report. This is what you need to find out. So what is answer option A, Y, B, and C? Answer option A, answer option B, and answer option C are all suggestions. Okay. So your duty over here is to find the suggestion that is coming from this report given in this memo. Okay. So that clarity you must have. Right. Okay. So now let's try to understand what is the very first suggestion over here. So answer option A is a suggestion. So let's read what the suggestion is. The suggestion is this: data about patient errors may be incomplete. Okay, so over here, data means information. Okay, so information about patient errors. So patient mistakes. Okay, patients are making certain mistakes and that information may be incomplete. Okay, so that is the first suggestion over here. What is the second suggestion? Here also they're talking about errors, but this time the errors is linked to hospital staff. Errors by hospital can often go unreported. Okay, that is, if the hospital staff is making an error, it goes unreported. That is, they will hide it. Okay, they will not report it. The medical staff, they are very cunning. What they will do, they will keep it hidden. Okay, that is the suggestion coming from this report. Now, the third suggestion is this: errors in prescriptions pose the greatest threat to patients. Greatest means what? Number one. Okay. So the number one danger to patients is prescriptions. Okay. Errors in prescriptions. So over here, sometimes they will write in this paragraph that it is one of the greatest. Okay. Now, even if they write one of the greatest or it is the second greatest. Now, see, I'm just giving you an example. Maybe you see a sentence and here they're writing errors in prescription poses the second greatest threat to patients. So second greatest threat means what? It is not the first, it is the second. So even if that's one extra word is coming, you cannot choose that as the correct answer. What is given over here, that only you have to choose. Okay, so anyway, that is a little bit off topic. Now we have done the keyword analysis. All right. So like this on your examination day. So see, I told you right now you're all very comfortable. You're very happy. You're at home. Okay. You have super energy. But on the examination day, this is not the situation. Okay, so you must have your pencil in hand and you must, underline, you must, highlight the words with your pencil like this. Okay, that constant interaction, having a communication with yourself is very, very important. You must ask yourself a lot of questions so that negative energy will not impact you in a bad way. Right. Now, keyword analysis we have done. Now, what we have to do? The verb analysis. Now, why is verb analysis important? The verb analysis is important to eliminate the incorrect answer options. Right. So, what is the verb over here? Verb means any kind of an action, okay, movement. Data about patient errors may be incomplete. Okay, so this we can say, okay, there is an, what is the action over here? The action, okay, so again, the focal point over here is, it is incomplete. Okay, so that is the suggestion over here. Okay, so you have to just focus on that one single word. Data about patient errors may be incomplete. Now, what is the verb in answer option B? Errors by hospital staff can often go unreported. Okay, so that is can go unreported. Okay, can go unreported means they will not report it. So that is the action over here. That is the verb over here. And that is the suggestion, right? Now, what is the verb in answer option C? C is telling errors in prescriptions pose the greatest threat to patients. Now, see over here, the greatest threat. Okay, so that is the verb over here. Now you see it becomes little bit more easy, right? Okay, so now what is your duty? My duty is to find whether the report is suggesting data error is incomplete, errors go unreported, or prescription errors are the greatest threat. Okay, so this you have to register into your mind. You have to register into your memory. And once you have comprehended the question like this, and once you have retained the memory of the question like this, then with an aim, okay, with a focus, with an aim, you have to read the paragraph over here. What is the aim over here? Okay, there is a report inside this memo, and what is the suggestion of the report? That is what your duty is. Okay, and you have to have a small memory of the answer options as well. Right. So now let's take a look into the main topic over here, the paragraph over here, and let's see what the OET has given us. So this is the topic. Report on oral anti-cancer medications. Oral anti-cancer means tablets, capsules, pills and all. Okay, anti-cancer medications. Okay, so let's read what the report is. Nurse unit managers are directed to review their systems for the administration of oral anti-cancer drugs and the reporting of drug errors. Okay, so this is an instruction. Okay, directed. Direct means I direct you to do this. I direct you to do that. Means what? I am instructing. Okay, so this is a synonym for instruction. Okay, so who is instructed over here? Nurse unit managers. Okay, that is managers who are responsible for nursing units. Okay, they are instructed, and what is their duty? To review their systems. Review means to monitor, to check their systems for the administration of oral anti-cancer drugs. Okay, administration means what? Giving. And reporting of drug errors. Okay, so what is the duty of these managers? Their managers is to supervise administration as well as reporting of drug errors. Okay, serious concerns have been raised. Now, serious problems have been raised in a recent report drawing on a national survey of pharmacists. Now, this is the report. So, a very serious problem. Okay, so this report is showing a very serious problem. Okay, on a national survey of pharmacists. Now, let's read what is the report. Now, that is the duty, right? Our duty is to find what the suggestion is coming from the report. So, this is the main answer. The answer should be over here only. Please note the following paragraph quoted from the report. Okay, now this is the report, and this is where you have to be very, very alert, because you can guarantee that the answer is going to be here. From this, what is your duty? To find the suggestion. So you have to think like the writer. Okay, so let's see what the writer is writing. Incorrect doses. Incorrect means what? Errors. Okay, incorrect. See, this is a synonym. So instead of writing errors, they have written incorrect. Incorrect means opposite of correct. Okay, incorrect doses of oral anti-cancer medicines can have fatal consequences. Fatal means very, very dangerous. Okay, very, very life threatening. Life threatening is the meaning of fatal. Okay, over the previous 4 years, so the past 4 years, there were 3 deaths and 400 patient safety issues. Now you see, now they're talking about statistics. How many deaths have happened? 3 deaths. And how many patient safety issues? 400. So they're talking about statistics over here. Everything is regarding oral anti-cancer medicines. Half of the reports, okay, that is 50%. 50% of the reports concerned the wrong dosage. Okay, now wrong dosage means what? I think it could be errors in prescriptions. Okay, errors in prescription posts. Okay, half of the reports concern the wrong dosage, frequency, quantity, and duration of oral anti-cancer treatment. Okay, so here they're talking about yeah, what are the types of errors? Okay, what are the types of errors that is happening? Okay, so these are the types of errors. Okay, that is incorrect doses, wrong dosage, wrong frequency, quantity, duration, everything. Okay, anyway, let's keep reading. Of further concern is that errors on the part of patients, errors from whom? Errors on the part of patients may be underreported. Now see over here we have three types of errors. Okay, so here we have errors regarding patients. Okay, so give very importance to the keywords over here. See, this error is regarding patients. Okay, this error is regarding hospital staff. Okay, and this error is about prescriptions. Okay, so every error has a linking word over here. Now here we are talking about answer option A. Okay, errors regarding patient errors. Okay, so if you come close to this particular thing over here, now you see here they have written, of further concern is that errors on the part of patients may be underreported. So part of patients may be underreported means you must come to answer option A. Okay, and here what is saying? Patient errors may be underreported. Underreported means it is not fully reported. Okay, in light of these reports, that is, coming to the knowledge of these reports, there is clearly a need for improved systems covering the management of patients receiving oral therapies. So here they're telling because of all these things, in the future, we need a very good system. We need a very improved system that takes care of the management of patients receiving these oral therapies. Okay, so like this, you have to read the paragraph over here. Okay, and this looks very small and tiny, but it is actually a very complicated paragraph. Now, if you coming to the strategies, okay, coming to the strategies as I told you, see, on your examination day, you will not have this much time to read everything in full detail. Okay, you have to give importance to the question. You have to do the keyword analysis, the verb analysis, and with that memory, you need to read the paragraph. Right. Now, as you can see over here, we have done the verb analysis before. Okay, so what is the verb analysis? Here, the verb analysis was this: patient errors may be incomplete. Here, the verb analysis was errors by the hospital staff can go unreported, right? And here it is the greatest threat over here. Okay, now let's come to answer option A. What is answer option A telling? Data about patient errors may be incomplete. So did we read that earlier? Yes, we read that over here, right? What is it saying? Errors by patients. Errors on part of patients means errors by done by the patients may be underreported. Okay, so that we cannot really eliminate. Okay, underreported means what? It is not fully reported. Okay, it is less complete. Okay, so what we can do, we cannot entirely eliminate it. You can put a question mark over there. It can be correct, it can be incorrect. Okay, now as you can see over here, this verb, okay, this verb is clearly mentioned. Yes, and this keyword is also clearly mentioned in that particular thing. Okay, the verb is mentioned, the keyword is mentioned. So therefore, we cannot eliminate it. You can put a question mark there because you suspect that could be the right answer. Now let's come to the second verb. So second thing is what? Errors by the hospital staff can go unreported. Okay, errors done by the hospital staff. Now, did we read anything regarding errors done by hospital staff? Now you see over here, there is nothing related to errors done by hospital staff over here. Okay, incorrect doses of oral anti-cancer medicines, fatal consequences, 3 deaths, 400 patient safety issues. Okay, half of the reports concerned wrong dosage, frequency, quantity, duration, or oral and of oral anti-cancer treatment. So here they're not really blaming the staff, and they're also not talking that errors done by the staff is underreported. The keyword and the linking word and the verb is missing over here. Okay, so what you can do, since nothing is mentioned, the staff is not mentioned, errors by the staff is not mentioned, and report it is unreported, nothing over here is mentioned. So what you can do, you can eliminate answer option B, and you suspect that answer option A could be the correct answer. Now why is B eliminated? Now you see over here, this verb is not mentioned, and this keyword is also not mentioned. So you have to see, even though you don't understand the language, even though you may not understand the language, what you can do is you can just give importance to the verbs and the keywords, and you can come back and forth and try to eliminate. Now see over here, what I'm trying to teach you is, don't try to focus the correct answer. When you're trying to focus the correct answer is where you experience more difficulty, but rather focus on eliminating the incorrect answer options. So none of these things are mentioned over here. So you can easily eliminate answer option B. Okay. Now let's come to answer option C. Now what is the answer option C telling us? Errors in prescription pose the greatest threat. Okay. That is the number one danger. The number one danger to patients is coming due to errors in prescriptions. Okay. Now, did we read that the greatest threat, okay, out of all these issues, the most dangerous thing is errors that is coming in prescription? That is also not mentioned. Okay. So since that is not mentioned, what we will do? Okay. The greatest threat. This is the verb over here. We are not reading it anywhere. Okay. So you can very easily eliminate answer option C. So we have eliminated B, we have eliminated C, and we have the answer option, which is the most difficult. Now you see, this is the answer option that is the most difficult to eliminate. And since that is the answer option most difficult to eliminate, by default, what will happen? Answer option A will be the right answer. Okay, so this is how you bring in the elimination strategy. Okay, and as I told you, on your examination day, you will not be able to think very clearly. Now, you see here, we are taking a lot of time to explain, and still you may find it difficult. So just imagine on the examination day how you will feel in that negative mental state. Okay, so you have to train yourself from this day itself to prepare yourself for that moment. That thorough preparation is very, very necessary, and that comes through repetition. Right. Now, it is very very smart to understand the tricks of OET. Okay, so let's just take this document that I have prepared over here. So I will be sending this document to you through WhatsApp, okay, after the session is done. Okay, now let me teach you the right strategies. Okay, because having the right strategies will make it more beneficial for you. Now, the first thing that you can do is that understand the question type. Okay, if you're there are different types of questions in reading part B and even reading part C. Reading part C has even more different types of questions, right? So if you understand the question type, it becomes a little bit more easy. Okay, so here, what is the question type over here? The question type is this one: identification of the main idea or the overall message. That is, you have to read the report. You have to read the report and you have to find what is the suggestion. Okay, so in order to find the suggestion, you have to basically understand what is the overall message. That is, you have to read the entire thing. Okay, suggestion. See, suggestion basically means what you have to understand. Okay, what is the, what is the intent of this particular message? Okay, so here you are expected to identify the main point or key message of the paragraph. The answer will not usually be a detail, okay, but it will be a summary of what is being concerned. Okay, so I'll send this document to you. You will be able to, you can read this document and find the answer on your own. Okay, so anyway, these are some skills that you need to have. Okay, some skills that you need to master is a scan for purpose. Okay, so here, what is your duty over here? Your duty over here is to find what is the suggestion of the report. So your purpose over here is, my purpose over here is to find what suggestion is being given to me by this report over here. Okay, spot the implication. Okay, that is the correct answer is based on, one second, is this the, yeah. Okay, spot the implication. Implication means what is the implied meaning. Okay, eliminate distractors. Distractors means the incorrect answer options, and pay attention to modifiers. Okay, so I'll send this document to you later on. You can go through this document, and then if you have any doubts, you can clarify with me. Right now, anyway, coming to the synonyms over here. Okay, so you have to really understand that when it comes to OET, there will be a lot of advanced vocabulary, and you have to understand the synonyms. Now, see, fatal consequences. Fatal basically means life-threatening, severe harm. Okay, it can even cause death. Okay, review. Okay, review basically means audit. Okay, audit or reassess. Okay, like that. Half of the reports concerned means a large portion. Okay, so like this, I'll be those who want a little bit more extra information on this, I'll be sending you this document later on. Okay, so anyway, that is the strategy that we can implement over here. Okay, so this is a little bit tougher. So those who are a little bit new to the OET reading and all, the very first day itself, you may actually feel that this is a little bit complex, but the truth is it is a little bit complex. Okay, it is a little bit complex only. It is not entirely easy. A lot of strategies is required, and you have to slowly bring up the skills that is necessary. Right. So now let's go to the fourth question. Okay. And let's see if you are able to do the fourth question as we discussed. Okay. So I'm just going to give you the tricks, I mean, the strategies over here. Okay. What you have to do first, you have to comprehend the question. Okay. Read the question, understand the question type, understand what is the duty over here. Then you identify the keywords, and more importantly, you identify the verbs over here. Okay. And retain this question to your memory, and with a lot of clarity. Don't hurry yourself. Don't put yourself in any kind of tension. You need thought clarity. Higher your thought quality, it will be easier for you to find the answer. And with that mindset, with an intention, you read the passage. With an intention, you read the passage, and you must always expect for synonyms. Okay, synonyms will be there. And as I told you, don't try to find the correct answer, but rather try to eliminate the incorrect answer options. Whichever answer option is the most difficult to eliminate, that will be the right answer. So this is the right way to deal with a multiple choice question. Okay. So I'll give you 2 minutes time to read the fourth question and the paragraph. Hmm. Right. Okay. Does anyone have any doubts over here? Is there any word or any phrase or any doubts that you have? If you want, you can type it in the chat box or you can just let me know. All right. So let's very smartly approach this particular question. Okay. So let's be very smart over here. Okay. So hard work is not that impactful. Smart work is. All right. So good. Everyone has written the what you believe is the right answer. So let's understand the question. What point? Point means what? What particular message? Okay, so what point means only one particular message over here. Okay, so this is a direct question. What point does the training manual? So this is a training manual, so instruction manual make about anesthesia workstations. Okay, so there is workstations called anesthesia workstations. Okay, and regarding that, this training manual is giving one point over here. So what is answer option A, answer option B, and answer option C? All of these are points. Okay. Particular messages. Okay. So option A is one message, option B is one message, option C is one message. And from where are we getting these messages? We are getting these messages from this training manual. Okay. And this training manual is talking about anesthesia workstations. Okay. So this clarity you must have. Okay. Because without this clarity, you cannot expect to find the correct answer. So we are talking about anesthesia workstations and the training manual is giving us this information. And from this training manual, we get one particular message. What is that message? That is what our duty is. Okay. So let's understand what is point number one. Okay. So let's read the first question over here. First answer option over here. The first point is parts of the equipment have been shown to be vulnerable to failure. Parts. Parts means what? Components. See, for example, when you talk about a motorcycle, okay, the motorcycle will have so many parts to it, right? There will be two wheels, there will be an accelerator, there will be a seat, there will be an engine, headlight, and all that. Okay. So over here, parts of the equipment, okay, not every part, but some parts of the equipment have been shown to be vulnerable to failure. Vulnerable means what? Highly possible. Okay, it is highly possible to experience failure. So that is the point that this training manual is giving us. Okay, parts of the equipment is vulnerable to failure. What is second point over here? There are several ways of ensuring that the ventilator is working effectively. Okay, several means what? Method number one, method number two, method number three. Like that, there are different methods. There are different ways. Okay, ways of what? For ensuring. Ensuring means confirming. Okay, so we need to confirm whether this ventilator is working properly or not. And how can we find that? We can find that by several ways. And that is the point coming from this training manual, according to answer option B. What is answer option C? Monitoring by health professionals, okay, is a reliable way to maintain patient safety. Okay, so monitoring, that means supervision. Monitoring means what? Observation or supervision. So supervision by medical professionals is a reliable way. Reliable means what? Dependable. Okay, so dependable way to maintain patient safety. Now, our duty is to identify the right verbs over here. Okay, so that it becomes easy to bring in the elimination strategy. Okay, so what point does the training manual make about anesthesia workstations? Okay, let's read the verb from answer option A. Parts of the equipment have been shown to be vulnerable to failure. Now, as you can see over here, vulnerable to failure. Okay, so that is the action over here. It becomes vulnerable. It has been shown to be vulnerable. So that is the main focal point of the first answer option. Now, what is answer option B telling? There are several ways of ensuring that the ventilator is working effectively. So over here, there are two things, two verbs, working effectively, but the more appropriate word over here is ensuring. Okay. So several ways of ensuring, that is the verb over here. This is the main focus. Okay. This point is telling there are different ways to confirm whether it is working properly or not. So you have to identify the main verb over here. Okay, that is very, very important. Now let's come to answer option C. Monitoring by health professionals is a reliable way to maintain patient safety. Okay, so over here we have maintaining patient safety and monitoring. So we can say the more appropriate verb over here is this one, monitoring. Okay, monitoring by health professional is a reliable way to ensure patient safety. Now you see over here, like this, you have to understand, okay, this is what I need to focus on. So now the elimination. So once you read the paragraph, and when you're trying to eliminate the correct answer or incorrect answer options, all you need to do is, okay, is the paragraph talking vulnerability to failure? Is the paragraph talking about different ways of ensuring? Is the paragraph talking about monitoring? So if the answer is no, then you can immediately eliminate it. Okay. And if it is, sometimes it may be mentioned, but even if it is mentioned, you have to make sure that it is linked to the keywords as well. Okay. So that connection to keywords and verbs also you have to ensure. Only then you can choose that as the correct answer. Okay, so now let's read the paragraph over here. Okay, so now we have to scan for the information. So let's read the paragraph. Anesthesia workstations. Studies basically means what? Research. Okay, lot of research has happened. That is the meaning of studies over here. So many experiments, so many research on safety in anesthesia have documented means they have proof. Okay, have documented that vigilance means what? Alert. Okay, being alert. Okay, human beings are very alert. Human vigilance alone is inadequate to ensure patient safety, and have underscored the importance of monitoring devices. Now what is the meaning of this? Have underscored the importance of monitoring devices. Underscore basically means what? Underscore, that is to highlight. Okay, so for example, when we want to highlight some things, we can say we underline. Okay, so we can underline some important words, right? So for example, if I come across a very important word, what I will do, for example, if say functioning is an important word, I will underline it. Okay, so that is the meaning of underscore. Okay, underscoring or underlining means it is important. Now I want you to make the connection over here. So what is the first sentence telling? Many studies, many research on safety in anesthesia have documented that human vigilance, that is, or if only human beings are vigilant, then that is inadequate. Inadequate means it is insufficient. It is insufficient to ensure patient safety. Okay, and have underscored, and that means it has become necessary. Okay, this has highlighted the importance of monitoring devices. Okay, so many research was done, and from the research we have proof. And what is that proof? Human beings, they are inadequate. Okay, we make a lot of mistakes in our judgment, so therefore we need monitoring devices. Okay, we need monitoring devices to ensure patient safety. So that is the intention, that is the message coming from the very first sentence. So for this you need to understand the meaning of vigilance, you need to understand the meaning of studies, you need to understand the meaning of underscored. Okay, that vocabulary skill you need to develop. Now let's come to the second sentence. These findings means what? Results. So when you do a research, when you do an experiment, you will get some results, right? That is what we call as findings. These findings are reflected in improved standards for are reflected, yeah, these findings are reflected in improved standards for equipment design, guidelines for patient monitoring, and reduced malpractice premiums for the use of capnography and pulse oximetry during anesthesia. Okay, so here that is a distractor. So remember in the previous document I told you the OET will have a lot of distractors. Okay, so this sentence over here, a distractor. Here they're saying, okay, these results, they have reflected in improved standards. Okay, that is, it is very important to give importance to the design of the to the machine. Okay, guidelines, that is, we need to give importance to patient monitoring. Okay, reduced malpractice premiums for the use of. Okay, so this is just to trick you, they have used this particular sentence. Okay, during anesthesia. So basically what they're trying to say, during anesthesia you have to be very, very important. Okay, you need to have high standards for this particular equipment. Okay, it's a distractor over here, I'll be talking about that later on. Now let's come to the next sentence over here. Anesthesia workstations. Anesthesia workstations integrate ventilator technology. Okay, that is, they have ventilator technology with patient monitors. Integration means combination. Integration means what? Combination. So this technology is now combined with patient monitors and patient alarms. Why? To prevent patient injury. To prevent patient injury in the unlikely event of a ventilator failure. Now, what is this sentence telling you? When you read the sentence, what do you understand? Here, they are telling anesthesia workstations. Okay, nowadays, the latest ventilator, they have patient monitors and they have alarms. Okay, and why is this important? To prevent patient injury. Okay, in the unlikely event of a ventilator failure. For example, if a ventilator stops working, okay, if a ventilator stops working, what will happen? The patient is inside the ventilator, right? And the patient will have patient injury. Okay, but if there are patient monitors and if there are alarms, then what will happen? These monitors and alarms will inform the people. It will inform the people that the ventilator is no longer working properly, that there is a ventilator failure, and we can very quickly and we can come and save the patient. Right. So don't you think this we have read in answer option B? Now see, what is B option telling us? There are several ways of ensuring that the ventilator is working effectively or not. Okay, now what is B option telling us? Yeah, ventilator is working effectively. And how can we ensure that? By patient monitors and alarms. With the help of patient monitors and with the help of alarms, we can determine whether the ventilator is working effectively or not. If it is not working effectively, we can immediately save the patient. Furthermore, since the reservoir bag is part of the circuit during mechanical ventilation, the visible movement of the reservoir bag is confirmation that the ventilator is functioning. Now you see over here, first is medical patient monitor. So see what and all are the different ways. The first way is patient monitors. The second way is patient alarms. Okay. And the third thing over here is the reservoir bag. Now you see, the reserve bag is also part of the mechanical ventilation. The visible movement of the reserve bag is confirmation that the ventilator is working, functioning properly or not. Now see, there are three different ways in which we can determine if this thing is working effectively or not. So maybe let's just highlight it over here. Okay, now see. Right. So see, this is the benefit of reading the question first. If you read the question first, and then when you read the passage, it becomes much more easy for you to pinpoint the right answer. But anyway, let's be very honest. This is not a very easy question. Now you see the language they use, not a single word from the question is basically, repeated over here. Several ways of ensuring ventilator is working effectively. Not a single word from the answer option B is repeated over here. But still, that is the meaning over here. Right. But that's why I told you it is very difficult for you to choose the correct answer. So let's try to do the elimination strategy. Okay. Now, what is the verb analysis in answer option A? Okay. When we read answer option A, what did we read? Parts of the equipment have been shown to be vulnerable to failure. Parts of the equipment. Okay, so have they mentioned anywhere that this part, okay, the engine of the ventilator or this part of the ventilator, it is susceptible or it is vulnerable to failure? Is this verb mentioned anywhere? This part of the machine is going to be more likely to fail in the future. Do you see anything? So here they're saying studies on anesthesia have documented human vigilance is inadequate. These findings reflect on improved standards for equipment. So improved standards is important. Patient monitoring for this. Okay, and then with the help of technology, patient monitors, alarms, we can prevent patient injury. Okay, and we can confirm whether the ventilator is working or not. See what is the verb over here? Parts of the equipment have been shown to be vulnerable to failure. Okay, so this is the verb over here, and this is the keywords over here. The keyword is not mentioned. The verb is also not mentioned. Is there any part of the equipment that is mentioned? It is not mentioned. So it is not mentioned both the keywords as well as the verb is not mentioned. So very easily you can eliminate answer option A. Okay. Now let's come to answer option B. There are several, what is the verb we did? Several ways of ensuring. There are different ways, different methods of ensuring whether the ventilator is working effectively or not. So don't you think this is mentioned? The keyword is mentioned. Ventilator working effort, that is mentioned over here. And what about the different ways? Is that mentioned? That is also mentioned. Now let's see where it is mentioned over here. So for example, if you come over here, now you see this is the keyword. Okay, so this is the benefit. So even if you don't understand vocabulary, now you see this ventilator is functioning, that is mentioned. Okay, patient monitors, patient alarms, reservoir bag, the visible movement, all these things are basically mentioning the different ways in which we can find whether this thing is functioning or not, right? So you can say that B is suspected to be the right answer. So what you can do, you can put a question mark over here. You have eliminated answer option A, okay, and you can put a question mark because everything over here is mentioned, okay? The verb is several ways of ensuring is mentioned. The keyword is also mentioned. So confidently you can put a question mark over there. Now let's come to answer option C. Now what is the verb in answer option C? Monitoring by health professionals. This is the verb over here. Monitoring by health professionals is a reliable way to prevent patient safety. I mean, to maintain patient safety. Is this mentioned anywhere? That is, doctors and nurses should come and they should monitor the patients, and that is a reliable way. We did not read this anywhere. It is not mentioned anywhere. The verb is not mentioned. The keywords are also not mentioned. Patient safety is mentioned. Patient safety is mentioned. I'm not saying that is not mentioned. Patient safety is mentioned, but that patient safety, it comes from monitoring, patient monitors and alarms and reservoir bags. They are not talking about health professionals. So what you can do, the verb monitoring by health professionals, that is also not mentioned. So since that is not mentioned, you can eliminate answer option C as well. So A is eliminated, C is eliminated, which means B, which we suspect to be the right answer, since everything is mentioned, B will be automatically the right answer. Now you see the language over here. Now, was this a very easy English? Can you really honestly say that this sentence, this English that you read over here is very easy? Of course, it is not very easy, right? It is very advanced level of English over here, but you have to be comfortable, even if you don't understand the English, even if you do not understand the English, the trick over here is to comprehend the question, understand the question. Don't give too much importance to the paragraph, but definitely give importance to the question, and then identify the keywords, identify the verbs. And even if the language is very, very difficult, what you can do, you can try, you can come back and forth. Okay, answer option A, is answer option A mentioned? Answer option B, is that mentioned? C mentioned? Like that, you come back and forth, and then you choose the answer option, which is the most difficult to eliminate. That is how you can crack the multiple choice questions of answer option B. Okay. And very honestly, I will tell you, see, many students believe that answer option part C is difficult. Now, see, when you go to part C over here, there is 4 answer options: A, B, C, and D. Okay. And there are different words. So this is a vocabulary type question. Okay. Like that. Okay. This is also vocabulary type question. There is a reference type questions. This is an opinion type question. There are different types of questions. Right. So, but let me tell you, in my experience, sometimes I feel that part C is easier. Part C is easier because it may look tough, but it is a little bit easier because the language is slightly more manageable. But when it comes to reading part B, even though it looks very small, the language is very, very condensed. It's a very condensed format. So one sentence itself will have a lot of information. So there are no tricks. So some people say, what are some, sir, can you give me some tricks in OET? Okay, but I'm very sorry to say there are no tricks and there are no shortcuts. Okay, this is pure skill. Okay, this is pure skill and this is pure work. You really have to put in the work. Okay, you have to put in the work, you have to put in the effort, because this is an exam designed only for medical professionals. So you need to have that mental skills. Okay, so you need to bring in, you need to identify the skills, your weaknesses, your strengths, and slowly refine yourself to the point that any question you get, you will be able to get it. So there are no tricks over here, but there are certain strategies. There are certain strategies. There is a smart method to approach the question that will definitely help you out. Okay. So now I'll just give you little bit one or two general time management tips, and then we will have a small doubt clearance session. Now, see, for example, when you come to the part B question, now, for example, this is the reading part B question. So here there will be 6 questions over here, 6 questions in reading part B. Okay, so I'll just type it over here. Okay, in reading part B, there will be 6 questions, right? And then in reading part C, there will be extract 1, there will be 8 questions over there. And then we have reading part extract 2, C2, okay, extract 2, there also we have 8 questions. Now, how much time do you have? You have total 45 minutes, okay, 45 minutes for 22 questions. Okay, so in total, you get 45 minutes to complete 22 questions. So here you must be able to manage your time very, very carefully. So I would suggest that you spend, I would say, 16 minutes for one extract of part C, 16 minutes for the other part, this thing of part C, and then for 13 minutes for part B. So that leaves you approximately with how many minutes per question? 2 minutes per question maximum. This is very, very important. Okay, so you get 45 minutes, 22 questions. Everything is multiple choice questions. Okay, and if you want, you can do part B first, or if you want, you can do part C first. That is completely up to you. But please remember that you do not spend more than 2 minutes per question. Sometimes it will be an easy question. Another thing that new students need to understand is that all these 22 questions will not be the same difficulty level. All these 22 questions will not be the same difficulty level. Some questions will be easy, some questions will be medium difficulty questions, and some questions will be very difficult questions. Very difficult questions will take you a lot of time. Easy questions will take you only little amount of time. Okay, that is very important that you understand. So this is a good way of dividing your time. So part B, 6 questions, spend up to 2 minutes per question. So that is 13 minutes for part B. And then part B, part C and part C, you have 8 questions, you have 16 minutes maximum. So like this, if you're dividing your the time like this, you will within 45 minutes, you will be able to complete the 22 questions. Okay, so if you come across a difficult question, so for example, let's say that the fourth question over here, let's say that this fourth question, it is a difficult question, and even after spending more than 1.5 minutes, okay, you have spent almost 2 minutes, and still if you're not able to find the answer, what you should do? You must temporarily skip it. Okay, so this is very important message I'm saying. If you find a question and if it is taking you too much time, that is more than 2 minutes it is taking, then skip it temporarily. Don't answer it. You go to the next question. Okay, go to the next question and then you find the answer to this question. Like this, what you do is you find answers to all the easy questions first. Find answers to all the easy questions first, and then towards the end, you come to the question that you skipped, temporarily you skipped, right? And then in a very comfortable mind, without any stress, without any tension, think very logically, think very practically, and you will have a memory of this question previously, right? And with that memory, you try to find the answer. And still, if you're not able to find the answer, at least you do some guesswork. Okay, you do try to do the elimination strategy. At least one answer option, if you're eliminating, it will improve your chances of success. Okay, and choose that answer and go on. Okay, so this management of time, this time management is very, very important. Now, how to prepare for the OET reading? Okay, this I will say, and then we'll wind up the session. Now, see, on our examination day, okay, never underestimate listening, reading, writing, or speaking. All the 4 exams are completely different from each other. Everything has its own skills, right? So when you are preparing, so right now, all of you are in the preparation phase. So when you are preparing for the OET, you must make sure if you're writing the pen and paper based OET, go to Google Drive and you take printouts of the reading question papers and the listening question papers. Everything we have given you in the, so let me just open the Google Drive over here. Okay, everything we have given you access to Google Drive. So what all you have to do is just log into Google Drive, just click the link and you will be getting access to Google Drive there. And you take the printouts, and then with these strategies, keyword analyzing strategies, underlying the important words, this and that, you practice on your own. And once you have practiced, maybe you will get 30 correct answers. Okay, let's say that you did a reading or you did a listening. Out of 42, you get 30 correct answers. Now what you do, you open the OET exam mastery app. Okay, so the app that we have given you access, if you open the app, there you can just scroll down. You can scroll down and there are, several chapters. All the Cambridge University record lectures are available. You open the recorded lecture, you see whether you're able to clarify the doubts by attending the record lecture in the app, and then you make some notes. It is very important that you're making some notes when you're watching the recorded lectures. Okay, and then you try to understand where you're making certain mistakes. Okay, and then if you have any more doubts, still after that, if you have doubts, then you can reach out to me and I'll be clarifying those doubts for you. Okay, so it is a very slow process. It is not a very instant process. The OET is not a very instant. The preparation will take you some time. Okay, but you have to be very patient and you have to be very gentle with yourself. Okay, so I'll just show you how the Google Drive looks like. Okay, so and then we will have a session end to the session. So for example, if you just click on, let me just open this up. Yeah, so this is the study materials. So everything very neatly we have given you access, listening, reading, writing, and speaking and all. Right. So another thing I want to talk about is the importance of practicing with the official OET materials. This is where you open up. Okay, so if you open, okay, so for example, listening and reading, if you click, so again, very neatly, okay, you will not be getting this organized level of thing from anywhere else. Okay, it took a lot of effort to actually ever organize everything like this. Now, see over here, you can see official listening, you can see official reading, official listening. So these official folders have the original OET question papers. That is Cambridge University, it's a British university. That university is the only university that is responsible for making the question papers for OET. Okay, so that question papers you will be getting over here. And for example, click on this folder and here you can see all the Cambridge University question papers. So here you can download it one by one. You can take printouts of it. You can practice it. Repeat exposure. You have to do it. And then open the OET exam mastery app. Okay, so open the app, watch the record lectures there as well, and then attend the live sessions. And still, if you have doubts, you can just let me know and you can clarify it. So that is a systematic way to prepare for the OET. Right. So that is it. So does anyone has any doubts over here when it comes to reading part B? Does anyone have any doubts? Those who have any doubts over here can stay over here and clarify those doubts. Those who do not have any doubts, we will meet up in tomorrow's class. Tomorrow we'll be talking about OET listening.